Hi, I'm Dr. Queen Ramaraswi, a medical officer in the neurosurgery department at Robert Mangaliso Sobuka Hospital, and let's talk about traumatic brain injury. Traumatic brain injury is injury to the brain. So, trauma can be blunt or penetrating. Blunt force being any bump or any blow to the head or any jolt to the head that can have an injury to the brain, or penetrating trauma where there's a sharp object that can actually penetrate the skull itself, be it a knife or a steel pipe or anything along those lines. And traumatic brain injury can actually be classified from mild to severe, severe having long-term disability. So people can actually protect themselves because traumatic brain injury, most of them are actually preventable. So to protect yourself, you can do basic things. For example, I'm just going to point to my head. For someone who's actually riding a motorbike or a bike, you can actually put on your helmet. And then for people that normally use cars, make sure that you always have your seatbelt on. And then for children and elders, make sure that you try and prevent falls where possible and avoid driving under the influence of alcohol. And most importantly, if you are someone who drinks, be safe and rather drink at home if you can. So treatment depends on the severity. Mild, most of the time, is just observation and then symptomatic management. And then when it comes to severe traumatic brain injury, most of the time, or if not all the time, you require emergency care, meaning that we either have to do an emergency surgery to either relieve pressure in the brain or to evacuate a bleed in the brain. And most of the time after the surgery, patients or people with severe traumatic brain injury would require intensive care or ICU admission. And after that, they require long-term rehabilitation, meaning that you need a physio, OT, speech, and others who contribute to long-term rehabilitation of patients. So most patients who have mild traumatic brain injury actually can recover fully. But for those that have severe traumatic brain injury, the long-term effects, it's the long-term disability that they can have, having issues with either memory, having issues with concentration, having headaches, having seizures, having problems with using their bodies or independently caring for themselves, or having issues with returning back to work, or even having problems in terms of re-entering society in terms of their independency. So patients or people living with traumatic brain injury, one important thing I should have said is that most or some of the patients actually can die from this, but those that are still alive and have some disability, they require a lot of compassion, a lot of awareness, a lot of patience in order for them to live meaningful lives. Because in the long run, traumatic brain injury has some psychological implications for the patients and also for the families that needs to care for these patients. So it requires us as the community, healthcare workers, and also families as well to be patient, to allow patients living with a traumatic brain injury to live meaningful lives.